Hi, everyone. My name is Christina Mangurian. I'm a professor and vice chair in the UCSF Department of Psychiatry and Behavioral Sciences. And today I'm going to be talking about fostering resilience during COVID-19 for your staff. Okay, this is really a talk for managers and other leaders who are trying to support their people during this very difficult time. So very early on in the pandemic, Dr. Victor Sang had produced this visual, which is pretty clear because it kind of shows what he anticipated early on to be the impact of the pandemic. He understood not only would there be the impact of COVID-19 itself, but it would have secondary impacts upon chronic diseases and obviously upon mental health. And so you can see here that he had talked about the psychic trauma, economic injury, and burnout. Since he put forward that, graph showing what he predicted, there's actually been many studies about the adverse psychological impact of COVID-19. In fact, when you go on to Lit COVID, you can see that the weekly number of publications has increased dramatically. And in fact, as of mid-August, over 4,500 publications have been released around the psychological impacts of COVID-19. And from across the world. And uniformly, they find these groups to be most at risk: women and caregivers, younger populations, people of lower socioeconomic status, those on the front line, especially nurses, those at high risk of contracting COVID, and those in social isolation. I do want to mention frontline providers because we can obviously think about our brothers and sisters in the ERs or in the ICUs or on hospitalist services, but there's many other folks who are actually on the front line and other specialties that are less seen than others. So these might be specialties like OB-GYN or primary care, psychiatry, even radiology, delivering care that people need right now. And then other services like custodial services and food services who are very much on the front line as well. So I just want to say a word about that when you're thinking about the populations at risk. So what are the things that you need to know? Well, these are the main recommendations that we have for you. You can find these on the Tips for Managers and Leaders During COVID at UCSF's website, so you can look for that. But these are the clues and tips. The first thing is to support yourself, do check-ins during standing meetings, recognizing staff and providing support, other evidence-based strategies, getting feedback, and recognizing differences across employees. I'm going to get into each of these one by one. So supporting yourself. This is recommendation number one because it's often overlooked. Being a leader during COVID-19 is extremely stressful, and it's imperative as the leader that you be as well as you can be because it creates the tenor for the entire group and team. So remember to put your oxygen mask on first, and if you maintain your own well-being, your team will benefit. So it's a very good investment. The second recommendation is really, doing check-ins during regular standing meetings. You can choose what works best for your team, but carve out 5 to 10 minutes at the beginning or end of a meeting to understand sources of stress. Assure your staff that you hear them, work to develop approaches that address their concerns, and inform them of available resources. So here at UCSF, for example, there are resources to promote well-being through UCSF COPE. And so you could say, look, there's lots of resources here. I've used them. I encourage you to check it out. And so I'd actually use those kinds of words specifically because role modeling is very important, as is validation of employees and being responsive. So these are all actually evidence-based kind of recommendations about how to best support your people. I'll give a quick word about the UCSF Coping and Resilience Program. If you all do not know about it, it was a program that was created by Dr. Jackson Trish in the Department of Psychiatry and Behavioral Sciences in partnership with Human Resources and the Center for Digital Health Innovation. Within a month, she lifted a really phenomenal program that addresses all the emotional needs for all of our employees. And one aspect of the program that's really important is direct individual care services. So any employee can go online and text COPE to 83973 or go to this URL and answer some questions, and they can be triaged to care. Doctors Michael Marcin and John Chamberlain built the individual treatment component, and this is available for all UCSF employees, and they've actually expanded it to evening hours to be more helpful for your team. And there are also support groups. A lot of people have gone on to the website to kind of be navigated and see whether they could benefit from treatment. The third recommendation that I have for you is to recognize stress and provide support. So I think you already probably do this, and you want to continue to be the great leader you are, check in with individuals who on your team who appear to be struggling, recognize that even your strongest employees have their limits. And so during weekly meetings, rather than calling somebody out specifically, say, look, that you imagine many people are under stress and this isn't a sign of weakness, it's normal. And make sure they know what resources are available to them. Make sure that everybody is doing the things that they need to do to sleep, maintain a good diet and exercise. I mentioned COPE, but there's additional aspects of the COPE program that are available to your employees. So in addition to individual treatment, there's actually these special interventions and web-based resources, and I'll describe both of these. So the web-based resources, this was created by a good friend and colleague and brilliant woman, Dr. Alyssa Pell, who created this really robust website. This is available for everybody, even those outside of UCSF. It's got a curated list of free mental health apps, resources for caring for children, content that might be helpful for patients, webinars, videos, and as I mentioned, these tips for managers. This, has been used widely with over 100,000 accessing the site, 20,000, going to, viewing the webinars, and over 1,000 video visits. And then another good friend and colleague is the incredible Dr. Margot Pumar, who created special interventions. And these are really interventions tailored to different units within UCSF. So you as a manager could ask to receive one of these interventions, whether it be a town hall, which is an hour-long meeting facilitated by a Department of Psychiatry faculty, or resilience small groups, where the small groups could be talking about the stress they're under, or skill-based workshops. So you can reach out to me or Dr. Pumar to discuss those. The fourth recommendation is just examine other evidence-based strategies. And these are kind of making sure that your team gets good breaks. If you have 60-minute meetings that you normally have, try to end them at 50 minutes to reduce Zoom fatigue. These short breaks really encourage wellness, so even ask people to set up timers to make sure that they take the breaks they need. A lot of teams are doing, virtual happy hours, coffee breaks, lunch meetings, Slack groups, whatever works for your team, encourage it to happen because building community is really important for social support. And you don't always need to be there, right? As the boss, sometimes you don't need to be there, during those meetings. I would help create and foster whatever your employees think is most helpful for them. And then simple and genuine expressions of gratitude helps the person receiving it and delivering it. So recognize individual meetings in your team regularly, and it'll really help everyone. There's also, a really important thing is getting feedback and listening to your team and being responsive. You can do this in many different ways, and I'm sure you've established some way of getting feedback from your team. One way that's possible is by creating an online listening form. This was created by some of my partners at Stanford Department of Psychiatry. People could easily go onto this website, put in their concern either anonymously or not, and then tell the team what kind of challenges are going on. So this is something that you all could consider. And then finally recommending that there's differences across employee types. So we all know the data that Black and Latinx communities are impacted by disparities in COVID-19 care with the co-occurring racism pandemic. These communities of color are experiencing a great deal of stress, and so it's important to recognize this in your employee body. There's also strong evidence that women are taking a big hit in productivity with school closures. Asian community members are impacted by xenophobia statements. People with mental health issues are struggling about stigma. And then with the data, again, women, those early in the career, those with children, those with the least resources are high at risk. And so that's actually why one of the populations I worry a lot about are parents. So I just want to make sure that you all are aware of the resources for parents here at UCSF. You can access a lot of these resources here, and actually there's a child care referral service coordinator. Here's some resources if a child is at risk for drinking or drug use for those with teens. There's a video on the Department of Psychiatry and Behavioral Health Sciences website that's a balancing act of being a mom and a healthcare provider during difficult times. And this is that can be helpful for many of your employees. The main pearls are really putting your oxygen mask on first, trying to make use of time as efficiently as possible, and recognizing that really the key is just to be a good enough parent. And the other resource that I want to make you aware of is obviously resources online for families. And a lot of people don't know how to talk to their kids about COVID or help them cope. And so just know that these resources are available here. And a lot of these recommendations are recommendations that we think of when we talk to our teams, right? These are pearls to help our children. These are pearls to help our teams, and to help ourselves, frankly, right? Routine, validating feelings, expressing uncertainty, and that's okay. Limiting our media exposure, exercising and socializing, being altruistic, and taking care of ourselves. There's many more resources available online at UCSF. Here are some of the resources that I mentioned about the main website, apps, and videos. But if you have any questions, please don't hesitate to reach out to me, and I'm happy to help point you in the right direction to get you the support you need to take the best care you can for your team. You're critical for their well-being. So again, I guess the main take-home is take care of yourself first, and thank you for watching this, because it means a lot. It means you really care about your team. So thank you. Be well.